Welcome to the Total Knee Replacement Pre-op Patient Education class. My name is Sarah Hewitt, a nurse and your care coordinator. I'll be joined later by Dee Dee Decker, one of our occupational therapists. Patient and visitor information. We ask that any visitors not enter the hospital if they have any cold or flu-like symptoms. Our main entrance doors open at 5 a.m. and they close at 8 p.m. That being said, for you when you're coming in for surgery, the main entrance doors will be open. And if you have any visitors that are arriving before 5 a.m. or leaving after 8 p.m., they will have to enter and exit through the ER entrance. You are allowed to have 2 visitors here at the hospital during your surgery, and only one of them can come back to the same day surgery area once we get you prepped and ready. And when you go back for surgery, then they'll go back out into the waiting room. Once you get admitted to the hospital, if you're spending the night, you can have as many visitors as you want. There are no restrictions. Your one coach can spend the night with you if you desire, and we do ask that your coach wear their coach button, which looks like this. So this coach button will let us know that it's okay to talk to your coach. And also, if they're roaming the hallways at midnight, we know they're okay to be here. Class objectives. I want to make sure that you understand your procedure, what to expect during your hospital stay, the role of your coach. We'll talk about pain management, what physical and occupational therapy we'll be doing while you're here at the hospital, the expectations we have for you at home, the discharge planning, and the big purpose of this class is to ease your anxiety and answer any questions that you may have. The role of the care coordinator, myself, is teach part of this education class. Daily rounds, I am here Monday through Friday, so I'll be coming in to check on you. I'm your advocate, so I want to make sure that you're having a good experience. Each morning I will meet with your nurse and case manager, and we'll chat about you and what you might need for discharge. We'll make sure all that's arranged before you going home. And you should be receiving some text messages pre-operatively and post-operatively with reminders and checking in on you. You will be up on our 4th floor. It's a dedicated unit. Our staff went through training so they know how to take care of patients who are having a joint replacement. We're all private rooms, so no roommates while you're here at the hospital. We have a rehab room. As you can see in the picture, we have a tub shower combo. Our occupational therapists like you to have a shower bench. What's nice about the shower bench is it allows you to sit on the outside of the tub, swing your legs over, and have a place to sit during your shower. You may not have the endurance to stand up for your entire shower, so it does give you a place to sit. We have a practice set of stairs, so if you have any stairs at home, we'll want to make sure we practice those before you leave the hospital. So why do you need the knee replacement? Your poor knee is worn out, it's bone on bone, it's painful to walk, and you can't do the things you enjoy to do. You probably have a lot of swelling, and so our goal is for you to have a more healthier and fulfilling lifestyle. Some of your surgeons may use a robotic arm-assisted device for your joint replacement. This usage depends on your surgeon preference, so not all surgeons will use it. What this does is it will line your surgeon up to help make those precise cuts on the joint. If you do have this procedure done, you will have a CT scan prior to your surgery so it can map out that joint. And also, in addition to the main incision you will have, you may also have a small little incision near your main incision, and that's where the little sensors go for the robot. When having a total knee replacement, some patients think we're cutting off the entire knee. We're not cutting off the entire knee, we're just resurfacing the area that you already have. So let me show you the model. So with a total knee replacement, this is what it will look like. So this bone right here, this is your femur. This is that top bone. And so we're going to resurface it with the silver part. The silver part you see is a mixture of metals. On the bottom, that's your tibia, that's the shin bone, and we'll cut that straight across and we'll put a silver piece and then this plastic piece. It's actually really plastic, and that allows those 2 components to slide nice and smoothly along each other. You will also have your patella, your kneecap resurfaced with this little plastic button, and so that lays against that knee replacement smoothly. Okay. Also on the screen, you will see what your x-ray looks like after your surgery is completed. Some patients only need a unilateral knee replacement, and that is where just one side of the knee has gone bad. So I do have a model of that as well. And that looks like this. And so it's just that one side, if you can see, just the one side is being replaced. And so you may not need both sides. So that is called a unilateral replacement. Same thing as the total, except half of it. And in the screen on the picture, you will see that x-ray post-op. Risk factors with having a joint replacement are blood clots or pulmonary embolisms, and we're going to talk about those in more detail. Blood loss, and the risk of losing too much blood is pretty rare nowadays. We give you a medication called tranexamic acid that helps slow down the loss of blood. Stiffness or persistent pain, this is where your job comes in. You need to make sure you're moving that knee. When you go to therapy, your therapist will let you know how much movement you should be doing, and when you follow up with your surgeon, they will let you know if that knee is not moving like it should, and they could take you back to the operating room and do something called manipulation of the knee under anesthesia. And what that is going to do is going to stretch those muscles, because as your knee is wanting to heal, it kind of wants to constrict and get tight. And so your surgeon will take you back and stretch those muscles back out. There'll be no cutting, but you will be asleep for it because you don't want to be awake for that stretching. Now, I will let you know, not very many people need that procedure done, but it is a risk factor. Scar tissue, everybody will scar differently. Neurovascular changes, you may have some numbness on the outside of your knee where the incision is, and that is totally normal. It could take several years to come back, so not to worry about that. If you have any underlying medical conditions or problems with anesthesia, that's why we have you go through the pre-admission testing process. Less likely complications to happen are damage to the big blood vessels and nerves, infections, problems with wound healing, and death. Just know these are less likely complications to happen. I want you to know that we take every precaution to make sure you have a safe and successful surgery. DVT or PE, so a deep vein thrombosis or a pulmonary embolism. A DVT is a blood clot that can form in an arm or a leg. It's where the blood clot becomes so large that it blocks the flow of blood. A pulmonary embolism is where usually a blood clot is formed somewhere else in your system, your body, and a little piece breaks loose and it goes through the heart and it gets stuck in the lungs. That one's a little bit more scary and life-threatening. We're going to talk about all the symptoms to be on the lookout for. Some risk factors for developing a blood clot is inactivity. Number one thing, we want you to get up and move. Day of surgery, we're getting you up and moving you. Dehydration. If you think about it, if your blood's a little dehydrated, it's thicker, and so that's more prone to develop a blood clot. Hospitalization, that's why we get you out of the hospital either the day of surgery or the very next day. Trauma will be the trauma of having the joint replacement. If you have a history of any kind of clotting disorders or a previous clot, varicose veins with the inflammation, any kind of hormone therapy, cancer, obesity, smoking, and age can increase your risk. Some symptoms of a blood clot, 4 main symptoms actually, would be swelling, redness, warmth, and pain. Calf, behind the knee, and the groin area are some landmark sites those blood clots tend to want to form, so monitor those areas closely. Sometimes the pain can feel like a muscle cramp, but a muscle cramp, you can walk that out. A blood clot pain is not going to want to walk out. It's only going to get worse when you try to walk on it. And sometimes you may not have all the classic symptoms. You may not have the swelling, the redness, the warmth, and the pain. You could just have pain or swelling, and it could still be a blood clot. So make sure you're monitoring for those symptoms. If you have a persistent symptom that's not going away, a symptom you normally don't have, that would be a red flag you'd want to let your surgeon know right away. The symptoms of a pulmonary embolism, that would be the shortness of breath, difficulty breathing. You walk a short distance and you're already out of breath. Could have some pain in the chest or back, could be sweating, heart's racing, dizziness, confusion, passing out, coughing up blood, wheezing, running a fever. If you start having those types of symptoms, you're calling 911 or whatever the quickest route to the hospital is. So how can you reduce your risk, since I maybe made you a little nervous? Well, exercise and early mobility after surgery is number one. No long periods of sitting or standing. Usually every hour we want you up, switching positions, and really not being on your feet more than 5 or 10 minutes this first 1 to 2 weeks at a given time. Elevate your legs. That's going to help with circulation. Avoid crossing your legs. Controlling your weight. You are going to be wearing support hose for 4 to 6 weeks, and I'll review those TED hose in a little bit. And they're just going to help with circulation. And you'll also be on a blood thinner. We normally prescribe aspirin, either 81 milligrams twice a day or 325 milligrams once a day. Now, if you have a history of blood clots or Any other risk factor, they may prescribe a medication called Eliquis or Xarelto. If you experience any symptoms of a blood clot, a DVT, or a PE while you're here at the hospital, definitely let your nurse know right away. When you get home, if you have any symptoms of the blood clot in the lungs, the pulmonary embolism, you're calling 911 or whatever the quickest route to the hospital is. If you have any symptoms of the DVT, you're calling your surgeon right away, but if you cannot get a hold of your surgeon, you're going to be going to the nearest emergency room. We want you to look for signs and symptoms of infection. We don't plan on infection happening, but we want you to know what to look for. So if you start running a fever, having increased pain, swelling, redness, heat, any kind of abnormal drainage, any green, yellow, cloudy, thick, smelly drainage, or if your drainage is lasting over a week, you definitely want to let your surgeon know. Make sure you wash your hands before touching your incision. We do not want your pets to lay near your incision or lick your incision. So keep them away the best you can. If they sleep in the bed with you, we prefer them not to sleep in the bed. But if they do, put them at the foot of the bed, give them their own comforter, their own covers, and you just may want to change your bed sheets more frequently. We do want you to change your bed sheets at least once a week. Us as humans are covered with bacteria and we're constantly shedding those skin cells. So once a week, we would like you to put fresh bed sheets on the bed until you are completely healed. Some preparations and lifestyle changes, joint education class. You guys can check that one off the list because you're watching that now. Pre-admission testing. You'll be going to pre-admission testing anywhere between 2 and 3 weeks prior to your surgery. We do want you to stop smoking because that constricts blood vessels and softens bone, and we want that good oxygen getting to your joint to help it heal. Stopping alcohol because that is a blood thinner, and also we do not want you drinking alcohol while on pain medicine. Pre-op exercises, we will be doing those towards the end of the class to show you how to do those, and weight management. During your pre-admission testing appointment, the nurse will go over your health history, they'll go over your medications, prescription and over-the-counter medicines. We'll do some lab work, we'll do an EKG if you're over the age of 50. You may be required to have a chest x-ray and then a CT or MRI depending on the type of joint replacement you are having. You want to stop taking those GLP-1 drugs at least 8 days prior to your surgery because they slow down the emptying of your stomach. So those would be medicines like Wegovy, Ozempic, etc. It's the weight loss medicines, also diabetic medicines fit into this category, this GLP-1. You may have a consultation with one of our hospitalists if required and our anesthesiologist. If you do not see our anesthesiologist in pre-admission testing, you will see them the day of your surgery and they will discuss general versus spinal anesthesia. Both general and spinal anesthesia are safe options to use. It's up to you and your surgeon what anesthesia they will use. Spinal anesthesia, what it does is it make the lower half of your body numb, and they'll give you some medications to help you relax, put you into a light sleep. You'll still be breathing on your own, which is different from general anesthesia. General anesthesia, you are completely asleep and you've got a breathing tube. Some benefits of the spinal anesthesia is you're probably going to wake up quicker in the recovery room, less risk of that nausea and vomiting, decreased risk of bleeding with a decreased risk of needing a blood transfusion, improved post-operative pain control, and decreased risk of a DVT or a PE. Spinal anesthesia side effects, you may have some difficulty urinating or some incontinence. Because we numb from the waist down, you may not be able to feel that you have to urinate, and you do have some incontinence. So you will wake up with a brief on. You may have some short-term back pain where we do the injection, and then on the rare side, you may have a spinal headache. And what that is where we do the injection, there's a little puncture hole where the medicine goes, and that little puncture hole may not seal as quickly as we'd like. And so when you sit up, you get this really bad headache. When you lay down, the headache goes away. So if that were to happen, you want to make sure you contact your surgeon. They'll have you on bed rest for so many hours, and they'll encourage you to drink lots of fluids and caffeine. General anesthesia side effects, you've got the classic nausea, vomiting, and sore throat. Medications that increase your bleeding, we do want you to stop those 7 days prior to surgery. So medications like aspirin, Motrin, naproxen, Aleve, Mobic, Celebrex, garlic, ginger, fish oil, vitamin E, herbal medicines such as ginkgo biloba and ginseng. There is a larger list of these medications in your guidebook that you can refer to. Also, if you are on any prescription blood thinners like Coumadin, Plavix, Xarelto, Pradaxa, Effient, Eliquis, you'll definitely want to make sure that your prescribing physician is giving you the A-OK of when to stop those medications. Tylenol is okay to take before surgery, and just make sure your surgeon is aware of all your medications. Good nutrition before and after surgery is vital to your wound healing. Eat a well-balanced diet. We like lots of protein and lots of vegetables. Those are super important for the healing. You are allowed to have fruits and grains and some sugar, but restrict your sugar intake because, as with a diabetic, an overload of sugar in your system will slow down your healing. We may be checking your blood for your hemoglobin A1C level, and what that is it's looking at your red blood cells over the past 2 to 3 months and seeing how much sugar is on them to see how well your blood sugar has been controlled. We do like you on a heart-healthy diet, so stay away from those greasy, fried, salty foods for a while, and then make sure you discuss any specific nutrition needs with your surgeon. If you're on a gluten-free or dairy-free diet, we'll want to make sure we continue that diet for when you're at the hospital if you're spending the night. Some other things to prepare you for surgery is your guidebook. So you all will get a guidebook either from your surgeon's office or when you come for pre-admission testing. It looks like this, and it has a lot of information in here, and it's split up into 3 sections. The first section's before the hospital stay, the middle section's while you're here at the hospital, and the third section's all about going home. We like for you to bring this guidebook with you to the hospital because our therapists sometimes will review the exercises that are in it, and then also bring it for your follow-up appointments because your surgeon may give you an x-ray of your new knee, and there's a nice front little pocket in here, and you can add it to that front pocket. But this is yours to keep forever and ever to refer back to, probably for several months after surgery. Choosing your coach can be a family member or a friend. They provide safety, comfort, motivation. They know your baseline. They can observe the therapy sessions, and then both you and your coach will gain the confidence that your coach can take care of you. At StoneCrest, we are a non-smoking facility. For the cafeteria hours, so as a patient, you get breakfast, lunch, and dinner every day of the week. But for visitors, our cafeteria is open Monday through Friday for breakfast and lunch. We're closed every day at dinner, and we're closed on the weekends. That being said, we've got some options. We've got vending machines in the cafeteria. Sam Ridley's full of restaurants. We also offer a meal ticket at the information desk that they can purchase, and that meal ticket can be used in your room on your menu, so both of your meals will come up at the same time. Also, our cafeteria only accepts debit and credit card, no cash. But if you only have cash, you can go to the information desk and purchase a meal ticket with cash and use that meal ticket in the cafeteria. That is also an option. Pre-surgical preparation, things we want you to bring with you. Number one thing, a positive winning attitude. We want you excited about having your knee replaced. I know having a knee replacement was not in the bucket of things to accomplish in your lifetime, but I'm sure there's some things you want to be able to do, so we want to get that knee fixed. Bring your guidebook, like we talked about, your insurance card and ID. Now, you will be showing that during pre-admission testing and registration, so we won't actually look at it the morning of your procedure, but just in case you need it for prescriptions or anything, we like for you to have it. If you have a CPAP or BiPAP machine, definitely bring that with you to the hospital. You're going to have anesthesia on board, some extra pain medicine. So when you do get to sleep, you're going to get into a deeper sleep. So we definitely want you to bring that with you. Check the tubing, check the filter, check the wiring, make sure there's no frayed wires. Our biomed technician will take a look at it to make sure it's safe to use. We also like that you bring your favorite pillow if you want. Put your pillow in a pillowcase other than white. Our linen is white, and we don't want you to forget your favorite pillow. Bring your cell phone charger, your hearing aids and batteries, any hygiene items you would like to have. We carry most items here except for deodorant because it's not compatible with our CHG solution. Bring some loose fitting, comfortable clothes, things you would lounge around the house in. Just make sure it's not tight around the knee. Bring comfortable walking shoes. We don't like Crocs or flip-flops at the hospital, and please avoid those tight-fitting shoes because your feet might be a little swollen after surgery, so those tight-fitting shoes might be really difficult to put on. Leave your valuables, cash, medications at home. We do not want you to self-medicate. The only money we would want you to have is money for maybe prescriptions to pick up after surgery. Remove your nail polish, protect your skin from cuts and sunburns, And the reason for that is because any kind of open area on your body can be an entry point for infection. We do like you to have your first outpatient physical therapy appointment arranged prior to your surgery. Reason for that is if you wait until you're here for surgery, your location and your preference for time may not be available. So we prefer you to have at least that first appointment arranged prior to your surgery. Newsletters, daily homework, and coach's checklist. You will receive these on arrival to your room, and these are what I like to review with you when I come to see you. I call this the Cliff Notes to come into class. It reviews those daily activities, expectations, and reminders. Incentive pathway is in your guidebook. It's also in the room if you're spending the night, and basically it's the goals to achieve prior to discharge, so we'll be checking those off throughout your hospital stay. Enhanced surgical recovery, that's a research-based program that we've adopted, and there's lots of things that are beneficial for the patient. It involves the patient more in the surgical experience, and as you can see on the screen, there's lots of benefits to the enhanced surgical recovery program. Night before surgery and morning of surgery, we do not want you to have anything to eat after 11 p.m. the night before your surgery. You are allowed to have clear liquids 2 hours prior to your arrival to the hospital. Now that could change depending on you and the type of surgery and your surgeon, so just make sure you listen to the pre-admission testing nurse and they will let you know when you can stop drinking those clear liquids. You can have medication as instructed with the clear liquids, and then you can also do the carbohydrate, or you will be doing the carbohydrate beverage as long as you receive this. You'll receive this at pre-admission testing. It is Ensure, but it's not the Ensure you buy at the store. It's a pre-surgical clear liquid beverage. It has carbohydrates in it. It is part of the ESR program. It shows that when you feed your cells during surgery, you feel better after surgery. So that's why we use it. Now, if you're a diabetic or on any of those GLP-1 medications, you will not receive this pre-surgical carbohydrate beverage. But if you're a diabetic, you can do just a sugar-free Gatorade, sugar-free Powerade, Propel, anything like that is acceptable. It has the electrolytes, but it doesn't have all the carbohydrates. If you are on the GLP-1 medications, you are actually not allowed to have anything to eat or drink 12 hours prior to your procedure because those medications slow down the gastric emptying of your stomach. Get a good night's rest. Remove your jewelry, any body piercings, those can cause a spark and burn you, and no deodorant the morning of your procedure because it's not compatible with the CHG wash that we will be using. Speaking of the CHG wash, you'll receive that during your pre-admission testing appointment. You'll use this plastic mesh sponge and you will use this wash. You'll get in the shower, you will suds up your entire body, minus your face, your hair, and your private areas. You'll suds up really good, let it sit on your skin for 2 minutes, and then you will rinse it off. You'll want to dry off with a freshly washed towel. We don't want you to put any lotions, perfumes, or anything on your skin because that will deactivate the CHG from working. Do not shave your legs or your neck for 2 days prior to surgery because the CHG solution can irritate your skin, and also we don't want any potential for infection. You want to make sure you have clean bed sheets to sleep in. You're going to disinfect your entire body, so go ahead and put those clean bed sheets on the night before surgery. If you test positive for MRSA or MSSA, we'll be testing this when you go through pre-admission testing. You'll be doing the CHG for 5 days prior to surgery and the morning of. In addition to that, you will also be prescribed mupirocin. It's an antibiotic ointment that'll go into each nostril. You'll use it twice a day for 5 days, so 10 total doses. The last dose we do like the night before your surgery. If for some reason you don't get to complete all 10 doses, that's okay. We just don't want you to use the mupirocin the morning of your surgery because we're going to be putting some other medication in your nose, and we do that regardless if you test positive for the MRSA or MSSA. There is a checklist in the bag of supplies that you will get from pre-admission testing, and you can bring that checklist with you so you know where you are with the CHG washes and the mupirocin, and then make sure you bring the mupirocin tube with you as well just so we can make sure that you are taking the correct medication. The day of surgery, you'll check in at the registration desk just like you did for pre-admission testing. We'll have you go to our same-day surgery waiting area. We'll come and get you as the patient. We'll get you prepped and ready, and then we're going to let your one coach come back and sit with you until you go off for surgery. When you're in the same-day surgery area, we're going to get you into a hospital gown. We're going to apply another layer of the CHG. So it is the same ingredient as the CHG wash, but this is a white form, so this will stay on your skin. There's a little diagram you can see on the slide. There's 6 areas of your body you will apply this to, and the same-day surgery nurse will show you how to apply this. We will also put in that nasal antiseptic I alluded to, and it's a povidone iodine, and it will go in your nose regardless if you test positive for the MRSA or MSSA, and it's going to kill bacteria in your nose for 12+ hours. During same-day surgery, we'll do a head-to-toe assessment. We'll make sure you're still feeling well for surgery. We're going to apply TED hose and SCDs. So each surgeon is a little different when it comes to the TED hose. You may have TED hose on or you may not. It's surgeon preference. If you do have TED hose, for a knee replacement, you will have the thigh-high TED hose. Reason for the thigh-high TED hose is because they go over the knee and they help with compression. One thing with the thigh-high TED hose is you want them high on your thigh, but sometimes they want to roll down your thigh and cause this big old ring around your thigh, and that is cutting into the circulation versus helping the circulation. So if that would be the case, you want to lower them down to where the roll goes to. That'll be the top of the TED hose, and then you'll have excess hanging off of your toes. Also, you want to check your ankles and behind your knee because they tend to want to bunch up behind there as well. So you want them to stay nice and smooth. You don't want any bunching up because that can cut into the circulation and cause more harm than good. To put the TED hose on, a little trick is a plastic bag over your foot, and there's a little hole at your toe, and then you put the plastic bag on your foot, put the TED hose over the plastic bag, and then you pull the plastic bag out of the toe. And so that's an easy way to put the TED hose on. But these will be yours to go home with, and we will send you home with an extra pair of TED hose. These are the SCDs. These are sequential compression devices. These will Velcro around your calves and help with circulation. I'll squeeze one calf and then the other. I call these your free little leg massages while you're here at the hospital. You will have an IV started for your surgery. We'll give you pre-op medication and any antibiotics your surgeon ordered. We'll be asking you questions over and over. Every person you meet, your name, your birthday, who's your doctor, what do you haven't done. It's not that we don't know, we just want to make sure we're all still on the same page. You will see one of our anesthesiologists and your surgeon that morning of surgery, so any last minute questions for them. And then your surgeon will mark your surgical leg. That way, when you're there in the operating room with you, we know we're operating on the correct body part as another safety measure. To help with pain management, we will do a nerve block, which you will receive in our recovery room holding area. It's an injection in the groin area, and it's going to help block that nerve to help with pain control after surgery. And also during surgery, you will have a periarticular injection. And what that is they will inject a mixture of medication around that knee capsule, and that will help with post-operative pain control as well. Your surgery will last about an hour to an hour and a half, but plan on being in the operating room for about 2 to 2.5 hours. That's the time it takes us to get you in the room, get you prepped and ready, get you positioned, and wake you up after surgery. We'll account for that extra time. Just know if there are any delays with the surgery schedule in front of you, we will keep you up to date the best we can. During and after surgery, your coach will go out into the waiting room. We do have Wi-Fi available so they can hook up to the Wi-Fi for their laptop or iPad. The coach will get updates throughout the procedure, so as surgery is getting started, each hour you're in there, and as surgery is wrapping up. There is a TV tracker in the waiting room where it has your initials and where you are in the process, so they can reference that as well. In order for anybody to get any information from you, there's a 4-digit passcode you will be assigned. You'll either get that during your pre-admission testing appointment or on arrival that morning of your surgery. So make sure if you want anybody to get any information about you, they do have that 4-digit passcode. Your surgeon will talk with your coach after the surgery is done, either in person or on the phone. So please be sure that the operating room nurse has the correct phone number for the person you want your surgeon to call, and make sure your coach answers all the calls that are coming to their phone so they don't miss the surgeon. The cell phone signal in our waiting room may not be great for your phone, and so you can hook up to our Wi-Fi signal for Wi-Fi calling. If you have any issues or not sure how to do that, our staff in the waiting room can help you get that set up. We also have a text messaging system called Informer, and what that does is it allows anybody to get on that and put your information in there and get automated text messages for where you are in the process of the surgery. So it's the same information that's on the tracker in the waiting room, but this can be directly texted to any of your loved ones so they know where you are. Recovery room, also known as PACU, that is where you will wake up after surgery. If you are spending the night, you will be on a hospital bed. If you have a history of sleep apnea or any cardiac issues, you may have a heart monitor on. You'll be in recovery room 1 to 2 hours, just depending on how quick you're waking up, how much pain medicine you're needing. We'll be monitoring your vital signs, heart rate, blood pressure, oxygen, respirations. We want to make sure you're waking up well. If you are spending the night, you'll be getting your vital signs on arrival, and then every hour times 3, and then every 4 hours after that. We'll be doing a neuromuscular assessment, making sure everything's moving well. So we'll have you move your arms and move your legs. We'll get your pain control down to a tolerable level. You may have a little bit of a sore throat if you did need the general anesthesia. Your coach is kept up to date. Your coach cannot see you in the recovery room, but once you get up to your room, your coach will be able to see you. And at this time, this is when your room number will be assigned if you are spending the night. So how are you going to be feeling? You're going to have a decrease in energy level. Your body's using a lot of energy to heal, so it's important to balance your rest with activity. You probably want to limit how many visitors are coming to see you so you can rest. Anesthesia may take a few days to get out of your system, so you may remember little to none of the hospital stay and even a couple days at home. You want to begin with light foods for your first meal. Your stomach is still waking up from anesthesia, and your appetite might not be well for the first few days or weeks, but try your best to eat as much as you can, as well as you can, get all those good nutrients to help with the healing process. We say call, don't fall. After surgery, you are at increased risk for falling because you've had anesthesia, you're on pain medicine, you've got an IV, you may have a drain, an ice pack, compression devices, impaired mobility due to weight-bearing strength and stability. So what to expect, you're going to have some yellow socks on that we'll have on you at the hospital. They're those yellow gripper socks, so you'll have those on, and those will help prevent you falling because the TED hose are pretty slippery, so we want you to make sure you have something on your foot, whether it's the slip-proof socks or house shoes. We will have a magnet, yellow magnet on the door. There's a yellow ceiling tile above your bed that says call, don't fall. We'll have a gait belt on you. Whenever you get up, we want to put this gait belt on. This is going to help as a little handle. So each morning you'll put this on, and it's just a way if you get a little unsteady, your coach or our staff can hold on to you. We will put a bed alarm on. We don't want you to try to get out of bed by yourself. Staff will be rounding on you on a regular basis. The expectations we have for you are to please press the call light. Even if you have to get up and go to the bathroom every 30 minutes, that's okay. We'd rather get you up instead of you trying to get up by yourself and fall. We will have you rate your pain on this 0 to 10 pain scale. 0 is no pain, 10 is the worst pain imaginable. For pain management, we use a multimodal pain management approach. What that is, it's part of the ESR program. Instead of giving you all narcotics, we can give you a mixture of medications like Tylenol, an anti-inflammatory, even a nerve pain pill, and all those medications work together to help control your pain without making you super sleepy. You will have a new kind of pain. It won't be that bone-on-bone pain. Also know with a knee replacement, you may have some thigh pain from where they do the tourniquet to help control bleeding during surgery. You want to intercept the pain before it gets severe. Don't be a hero. That's what the pain medicine's for. The pain medicine will be ordered PRN, which means as needed, so you will need to ask your nurse for your pain medicine. You want to take your medicine on a regular basis and take it at least 30 to 60 minutes prior to going to your physical therapy appointment and at bedtime. Let the nurse know if the pain medicine we're giving you here at the hospital is not working effectively, and also make sure you understand all the pain management efforts that we have in place. You do want to take stool softeners to help prevent constipation. A side effect of pain medicine is constipation. So in addition to taking the stool softener, you will want to stay hydrated and be mobile. Remember that we can't make the pain go completely away. Our aim is to get your pain down so you can eat, sleep, work with therapy, and get home as soon as you can. We do all we can to ensure your comfort and safety. What that means, if you're too sleepy or your blood pressure is too low, we won't be able to safely give you your pain medicine. You will not get addicted to the pain medicine as long as you're taking it as prescribed. Taking it as prescribed means you're hurting. Being in unnecessary pain will actually stress your body out, tense up those muscles, and slow down your healing. Pick one day each week to measure your progress. And remember, everyone's experience is unique and different. We are here as your care team to make your experience successful. And we now have a break. You can choose to pause the video at this time. I know we have gone through a lot of information. When you come back, Dee Dee will be talking about what to expect after your surgery.
Welcome back. My name is Dee Dee and I am the lead occupational therapist here at StoneCrest. Now we are going to talk about your recovery. Physical therapy is going to start post-op day 0. Yes, that is the same day as your surgery. They are going to get you up and out of bed. They want you to take a few steps. They probably won't take you up and down the hall or practice stairs with you that day, but they just want to make sure that you're up and moving and mobile. The next morning they will see you and they will practice those stairs and make sure that you're able to walk up and down the hall using your rolling walker, as well as review some exercises with you. Occupational therapy will also start post-op day 1. We care about you being able to do all of the functional skills that you are able and need to do once you go home. That includes dressing, bathing, and toileting. We are going to educate you on becoming the most independent you can while following some of your knee precautions. Let's talk about a few medical devices that you will see while you are here at the hospital. The IV pump obviously is attached to you and will give you some medicine, but let's also talk about our pulse oximeter. This little device attaches to your finger and it measures the amount of oxygen in your blood as well as your heart rate. This is our safety belt or our gait belt. It is what we use to put around your waist so that you are able to move safely without falling down. If it looks like it's inside out, then it's on correctly. So we just put it around your waist and hold on to you while you're walking or transferring in order to make sure if you do trip and fall, we don't use an arm and pull it out of socket. This is our incentive spirometer. Everybody who has a surgery here at StoneCrest uses one. It is what we use to help prevent pneumonia and help you open up your lungs following surgery. What you are going to do is you are going to suck in to this little tube in order to raise this little green knob all the way up to where your nurse has set it. This is to increase the volume of your breath. We want you to do this 10 times every hour, followed by 2 good coughs. You don't have to do all 10 consecutively. If you need to take a break between them, that is okay. But we still want you to do them 10 times every hour that you are awake. You're going to do this for 5 days following surgery. This is a goniometer. This is what the physical therapist will use to measure the bend in your knee. One of the goals that you have to meet in order to go home is that your knee will be able to bend to 90 degrees or will form a right angle. So this is what the therapist will use to measure it. These are SCDs. This will wrap around your leg just like this and will help pump blood back into your body. This is something that some of our surgeons choose to use, while others will choose to use foot pumps, which do the same thing but wrap around your foot rather than your calf. This is our polar cube. Any knee surgery who comes to our hospital gets this as a gift. This is something that we choose to give you. We don't charge insurance because we know how beneficial it can be. What it is pretty much a giant ice pack. Inside, you will see there are 2 lines. There's a number 1 and a number 2. You'll fill up the water to the number 1 line, and the rest of the way you'll fill up with ice. That ice is what they use to keep the water cold in order to pump through this filter and onto your knee. This ice pack will go right around your knee. We want you to wear this for the first 3 days after your surgery. 24/7. Yes, even while you are asleep. This is so wonderful and beneficial to your knee. It's going to help reduce your pain as well as your swelling. So we really love for you to use it. After about 72 hours, you can wean it to about 20 minutes on and 20 minutes off. By the end of the first week of your surgery, you will only be using this as needed. Something that's an important reminder is whenever you put ice on any part of your skin, please use a barrier, whether it is pants, a pillowcase, a tea towel, something to block that ice from your skin so it does not burn. Finally, let's talk about these little beauties. These are TED hose, compression stockings we use to help prevent blood clots. All of our knees will get thigh-high TED hose. You will wear these for about 4 to 6 weeks. We will give you a pair to wear as well as a pair to wash. Do not put these in the dryer. They will shrink and they will be really difficult to get on. Let's talk about a few surgical dressings that you could see on your knee. This first one is a Mepilex dressing. It is antimicrobial silver nitrate and it is used to be waterproof as well as help prevent infection. You will wear it for 7 to 14 days. The other dressing that you could get is this gauze dressing with a clear plastic top over it. This is, while waterproof, not safe for you to shower in. So you will be sponge bathing for the next 10 days following surgery if your surgeon chooses to use this type of dressing. This is George. He is our lead physical therapist. This slide is just to show you if somebody comes in your room with these colored scrubs, be prepared to do the work. There are a lot of goals you have to meet in order to discharge from our facility. Let's review a few of them. You have to be able to walk up and down the hall at least 100 feet while using your rolling walker. You need to get in and out of bed on your own. You also need to be able to climb and descend the amount of stairs necessary in order to get in and out of your house. We need to make sure that you can get dressed and get on and off the toilet with little to no help. And we want to make sure you're able to fully extend your leg and bend your knee to 90 degrees. So if you are having a bilateral total knee, we have a few suggestions on how to have the best recovery at home. We want you to take it slow and problem solve as you go. You don't have a good leg to stand on. Both are undergoing some recovery. So we want to make sure that you have somebody there to help you with toilet transfers, getting in and out of bed, on and off the chair, and really, we would love for you to be receptive to using some assistive devices that we will go over in a later slide. On the day of surgery, most patients will start walking that same day, post-op day 0. That first time you get up will be with a nurse or a therapist, but we do want to make sure you are out of bed within 4 hours of having your surgery. Your weight-bearing status is weight-bearing as tolerated, and what that means is you can put as much weight through that operative leg as you can comfortably tolerate. We ask that you do about 20 to 30 ankle pumps while you're in bed in order to help blood flow through your body, and we want you to do it every half hour that you are awake. Do not wake up to do your ankle pumps. We also encourage you to take it slow. Gain your balance before standing and walking and going to the bathroom, maybe having a schedule to get up and go to the bathroom instead of going when you feel the urge. The day after your surgery, we want most of our patients to sit up in a chair for all of their meals unless directed otherwise by your surgeon. You will have stair training in your morning and afternoon sessions if you stay towards the afternoon. Again, we want to make sure that you can walk at least 100 feet, and we want to make sure that you have little to no help with dressing, bathing, and showering. Your case manager will also come in to make sure you have a rolling walker, as well as that your post-op physical therapy is arranged once you discharge from the hospital. Let's review a few assistive devices that we think could be really beneficial at home. First, we have our walker. Everyone who discharges from our hospital after receiving a total knee surgery must use a rolling walker. It is so beneficial for you. It's going to keep your balance, it's going to maintain your safety, and it's going to make you feel more confident walking on that new knee. If you do not already have a walker, we will make sure you get one at little to no cost, depending your insurance. Something else that could be really beneficial once you go home is an elevated toilet seat or a bedside commode. This is especially beneficial if you don't have anything to push up off of next to your toilet or you have a very low toilet. Finally, having some sort of shower chair or installed grab bar in your shower is imperative for safety. We don't want you to slip and fall trying to get in and out of the shower and re-injuring this knee. Occupational therapists will also review a few assistive devices that could be beneficial for dressing, bathing, and toileting. We'll talk about a few of those now. This could be beneficial for you to use if you are showering and are unable to reach your feet. It's called a long-handled sponge. Next, I have a lot of patients that like to use this reacher in order to help them with dressing their lower body, such as pulling off their socks or threading their underwear or pants in order to pull them up because they're unable to bend down and pull them up themselves. You don't have any bending restrictions with a total knee surgery, but sometimes it is difficult and a reacher could be beneficial. This is a long-handled shoehorn. It is something that we use to put in the heel of our shoe in order for you to comfortably slide your foot into your shoe. It could be beneficial if you choose not to purchase Skechers slip-ins or New Balance Robes. Those could be really beneficial to get your foot in without having to use one of these. But if you have shoes that you know that you like, work for you, this is a great tool. Finally, our sock aid, and my personal favorite. This is so helpful in order to get socks on our feet, especially if you have difficulty bending down. You are going to pull the sock on where it is taut up here at the top. Be sure not to pull it over these knots. It can be as scrunched as it needs. But then you're going to toss it down to the ground, pull your foot through it, and when you feel like you're done, keep on pulling to pull it out. It works wonders. Also, if your same-day surgery nurse does not tell you about the trick with the plastic bag, ask your occupational therapist. We are happy to show you that trick with donning those TED hose that can be pretty difficult. A few guides we have for all of our daily activities. We always want you using an assistive device whenever you're doing any sort of daily activity. Please put away anything that can be a tripping hazard, such as a rug or any sort of tchotchke on the ground, like a basket of sorts. Make sure you're sitting in a supportive chair with armrests. Recliners are okay to use, but they might need to be modified, such as putting a pillow underneath your ankle in order to encourage extension in your knee. Something else that we ask that you do is to avoid sleeping on your operative side. This is surgeon specific, so please check with your surgeon if you are a side sleeper. Again, we really want to make sure that you don't put anything under that new knee joint. We want it to be an extension as much as possible. Of course, gather all your clothes prior to getting dressed and always thread the leg you had surgery on first. Wear slip-on shoes or elastic shoelaces in order to make it easier for you to get those shoes on and off. You're not allowed to soak in a bathtub until that incision is completely healed, but a few of you are able to shower. Check with your surgeon to make sure you are allowed to shower after your surgery. Again, bruising, blisters, and swelling is not uncommon. Do not be alarmed if you start experiencing these things. We like ice to stay on for those first 72 hours to help control pain. Then, after those first 3 days, wean them off to about 20 to 30 minutes on and 20 to 30 minutes off. By the end of the first week, you will only be using it as needed. Again, try to keep a barrier between your skin and that polar ice pack. And then always ice your knee after therapy sessions. Sometimes it's even helpful to raise your leg so that your foot is above your heart in order to help with swelling. Let's talk about a few pre-operative exercises that could be helpful for your surgery. First are ankle pumps. You just pump those ankles up and down as much as you can. We like to say about 20 to 30 times every half hour, but we want you to do them at least twice a day. The other thing that could be helpful are called quad sets. I encourage you to do these while you're laying in bed so you have a flat surface. What you're going to do is you're going to squeeze your quadriceps together and try to force them down into your mattress. Finally, something else that could be beneficial are called short arc quads. You are going to roll up either a sheet or a towel and place it underneath your quadricep muscle. Then with it lifted, you will gently lift your foot off the mattress, hold it for about 5 seconds, and then rest it. We want you to do those about 20 to 30 times twice a day. If you feel like your knee needs some assistance with bending already, the heel slides could be very beneficial. You're going to take your leg that is fully in extension and slide your heel up to your bottom and back down. Again, 20 to 30 times twice a day. Our Care Pathway Survey is the survey we use in order for Joint Commission to help approve us to do more surgeries just like these. You probably already received your first survey. We ask that you fill it out 30 days before your surgery. You're also going to get one 6 weeks, 6 months, and a year after surgery. And it just helps us know how well you're progressing following your surgery so we can present it to those governing bodies and they can give us the accreditation to do more. Going home, we always want to make sure that you use your primary pharmacy for all of your medications when you go home. Now, that could mean that there are some restrictions to your narcotic pain medication. If you have any difficulty with your pharmacy, please call your surgeon. We want to make sure you have your rolling walker before you discharge from our hospital. Again, your case manager will typically bring it to you if you've not received one from your surgeon or don't already have one. Typically, you discharge around noon or lunchtime, so we always ask that you eat lunch here and then discharge home. Make sure you have your ride ready to take you home. Speaking of somebody to take you home, we always want to make sure you have somebody that's able to care for you for at least the first week following surgery. They'll be able to make your meals, help you with laundry and dressing, and they might even help you with your pets. Pets can unintentionally cause falls, so please arrange somebody to care for them or at least put them away when you're coming home for the first time. Once you're settled, you can allow them to come out and greet you. Xarelto and Eliquis are blood thinners that we sometimes prescribe our patients who are allergic to aspirin. If this is prescribed to you, contact your case manager because they could have a coupon in order to help you save money. Your follow-up appointment is scheduled for between 2 to 6 weeks after surgery, and if staples are applied, they're removed at about 10 to 14 days. Now, you're not allowed to drive until you are cleared by your surgeon, so make sure you talk with them before you start driving. And the lifespan of your new joint is 20 to 25 years. Tracking your recovery. You are going through a lot after this major surgery. You are going to have highs and lows, ups and downs, good days and bad days. We encourage you to pick one day a week to measure your progress. Let's say every Tuesday. So every Tuesday, you will be able to see the progress you have made over that week. It becomes much more encouraging to you as well as your family members, instead of getting discouraged on what you couldn't do the day before or could do better the day before. If you are a Medicare patient, this is considered a bundle payment, which means all of your hospital stay is bundled together and given to Medicare to pay for. That pretty much means they don't want to pay for anything for 90 days after this surgery. So if you have any sort of elective procedure scheduled for 90 days following this surgery, I would suggest you move it or have it performed prior to your surgery, because nobody wants a hospital bill for a colonoscopy, EGD, or elective MRI. We also require that you take an antibiotic for at least 2 years prior to any dental procedure that you have. And that is because the bacteria in our mouth can get all kicked up during a dental procedure and travel down to our brand new knee joint and cause a really bad infection. Now, please talk to your dentist about what they prefer to do with the antibiotic. We have a variety of dentists with a variety of beliefs related to these antibiotics. So I would suggest calling and checking in with them about how you should take this antibiotic. If you want to make a homemade ice pack at home, we highly encourage you to do it. You can combine equal parts rubbing alcohol and water and combine it in a plastic baggie. I encourage you to double bag it to prevent leakage and put it in your freezer for a few hours to form a gel. This is something wonderful that you can put underneath your knee during that 360 icing. 360 icing is when you ice the top of your knee as well as the bottom of your knee for about 20 to 30 minutes, 4 to 6 times a day. We have a lot of surgeons that really encourage you to do this. So if they talk to you about 360 icing, this is a great tool to use in order to do it. Once you go home, we want you to create a home base. Keep everything you need that's necessary for you within arm's reach, including your phone, your remote control, a few snacks, water. The only thing that should be a little bit difficult to get to is your pain medication. Sometimes walking to the other room to get that pain medication could actually ease some of that muscle pain. Going to a skilled nursing facility is a thing of the past. We know that you recover better at home. And so we want to make sure that you're able to go home. But if you do have something happen and need to go to a skilled nursing facility for your recovery, you must spend 3 nights here at StoneCrest with us. This is not a rule that we have, it's actually a rule that insurance has that we must follow. But we know that you will most likely go home and know that you don't typically go to a skilled nursing facility following a total knee surgery. If you feel like any decisions are being made about you or without your consent, please talk to us. We know that this surgery is for you and we want it to be as successful as possible. We would like to invite you to our reunion lunch. It is held once a quarter in our medical office building and filled with patients just like you who have received a total joint surgery. It is a great time to fellowship with one another and share stories about your recovery, as well as let team members like myself see your progress. If you come in contact with a wonderful staff member, you are always able to nominate them for the following awards. If you have an exceptional nurse, you can nominate them for the Daisy Award. The Rose Award is for other staff members such as therapists, EVS workers, or dietary staff members. And you can always nominate your surgeon for the Mid-Level or Physician Award. My Health One is our online patient portal. It has all of the information related to your surgery in it, as well as hospital bills. We encourage you to create a login at TriStarStoneCrest.com or MyHealthOne.com. Photography and videos. We encourage you to take pictures of your patient recovering, but please know we ask that you do not take pictures of other patients and get verbal consent from therapists or other staff members when filming them or taking a picture with them. You will also get our Press Ganey survey. This is our patient satisfaction survey. So if you had a wonderful experience here at StoneCrest, we would like to hear about it. If you did not have a wonderful experience and something went wrong, we also want to hear about it. We don't know what we need to change unless you tell us. You can also review us on Google, Facebook, or Yelp. Thank you for coming to Joint Class. I appreciate the time that you have spent with us today. If you have any questions, you can contact Sarah via the number on your screen from 8 a.m. to 4 p.m. Monday through Friday. Thank you.